Hi, everyone. Thanks for joining me. I have been doing some interviews with different experts to talk about how COVID affects our community. And today we have with us Dr. Badour. She is a faculty member in the department with me at UK in psychology and does research on trauma. So we're going to talk a little bit about that. Dr. Badour, do you want to start by talking about your research and what kind of work you do?
Sure. So I'm a clinical psychologist, and my training is specifically in the area of traumatic stress and understanding the psychological impacts of traumatic events, including post traumatic stress disorder, anxiety, mood problems, as well as substance use.
Okay, and one of my first questions for you is just kind of getting your perspective. I've heard people talk about how we're all kind of experiencing a traumatic event right now in our culture. And I wanted to see how you think about that based on like the experiences that we're having and then what you know about trauma from your research.
Sure. So, this is an interesting question to think about because we've never had an experience like this before. And so, a lot of other traumatic events have been widely studied and their impact on people. And I think we're only just starting to see the impact of COVID. We can think about this as sort of like a shared global traumatic experience that's going to have a wide range of impacts based on the individual person, but also their own experience. So, people who are directly impacted by the disease or their family members or loved ones are going to have a very different experience than people who have not been directly impacted but say have lost their job, or people who have not lost their job but are dealing with anxiety over someone contracting the disease, or over trying to navigate childcare and working full time. And there's a whole host of challenges that people are facing. And I would say one thing I can say from the research community is I've been seeing on professional listservs a real global effort to try to determine like how can we best understand and measure and consider the long-term mental health consequences that are associated with both the outbreak of the disease, but also all of the social distancing guidelines and shutdowns that have occurred as a result.
Yeah, I feel like I just saw an article in the UK now about one of our fellow faculty members talking about what is social distancing, how it kind of affects us as people, which was an interesting read. Can
So
you talk a little bit about just mental health in general and what you recommend for the community for taking care of mental health in these times?
Yeah. So I think there's some sort of basic common sense recommendations that have been put out there in terms of trying to keep one's sort of schedule and routine as normal as possible in this very abnormal time. So it can be really easy when you don't have to leave your house to stay in your pajamas all day and not take a shower, especially on days that you might be feeling particularly down. I mean, I've had multiple conversations with people about, it's sort of a day to day, hour by hour in terms of how we might be feeling on a given day. But doing things like taking a shower, getting dressed, getting out of the house, particularly as the weather's getting nicer, even if it's just to go for a walk, can be really helpful for mood. Another thing I don't know that everyone might have on their radar, but getting good sleep is incredibly important because of its dramatic impact on mood and anxiety. And then I think probably one of the most important things is finding ways to remain socially connected, which you were mentioning in terms of one of our colleagues at UK doing a piece on. I think social distancing is an unfortunate way to describe what we need to be doing. I think we need to be physically distancing, but social distancing can have really in terms of like social isolation can have really negative impacts for our mental health. We're social creatures by nature. And so having people to support us either through kind of positive interactions to boost us up and entertain us during this time, or even just opportunities to kind of commiserate about the challenges that we're all facing, and remind ourselves that we're not actually facing this alone, I think can be incredibly important.
Yeah, and an extension of that, I know I didn't put this on our list, but it's kind of a follow up to the mental health piece is there's a lot more telehealth going on now. And then also like virtual support groups. Like I've seen a lot of those from the Pride Community Services organization, where they've moved the support groups that usually meet in person to a virtual format. Do you have any kind of insight on telehealth in general, or this idea of like moving to these virtual spaces? Are they as effective?
Yeah, so actually, there's quite a bit of research on this now because for many years, clinicians have been trying to conduct research to see if we could potentially expand to telehealth in order to better serve people living in rural communities who can't actually go to their community clinic. And it turns out that from the various research studies that have been conducted in this domain, that good evidence-based psychological treatment seems to be just as effective, whether it's delivered in person or online. And people generally report feeling a strong sense of connection with their therapist, even though it might seem a little strange at first to meet someone that you're going to be sharing, very intimate and personal details with just over the internet. But I think honestly, probably, and this is just sort of anecdotally, but I think we're all getting a little bit more comfortable with that now because it's something that we're all having to face. And so, yes, it's been an interesting from the provider perspective. It's been an interesting shift. Suddenly, providers all over the country who have never done their work via telehealth are now doing that. And I think there's been a lot of support from the state and from the local communities to try to help basically clear the way to provide as much mental health support as possible during such a difficult time when many people really might benefit from accessing it. I think one challenge that's still being navigated is what to do regarding health insurance, because obviously many people have, unfortunately, with our current system where healthcare is for many people tied to their employment, and many people have lost employment. They're concerned about, can I even afford this? Can I access this? And there are some resources for actually accessing mental health care, even if insurance isn't available to you. So one example I'll share is a couple of colleagues in the psychology department in the clinical area with me. We have a clinic on campus, the UK Clinic for Emotional Health. And one of the faculty members there is actually conducting a research study to provide evidence-based mental health care for free to the community. And so if folks are interested, can I make a little plug for that?
Yeah, is this the one that you had the article about?
Yes.
Yeah.
Well, there was some information about it, but slightly different article.
Okay.
This one is that this if folks go to the following website, centerforoemotion.com, and then click on the Getting Started tab. There's some information about this free treatment trial. It's a brief telehealth treatment that has been shown to be effective in reducing both anxiety and depression. And so people who might be just generally experiencing these things, but also perhaps elevations in these difficulties as a result of everything that's been going on, that can be like a great resource if you maybe don't have access to that due to your own kind of healthcare situation currently.
Yeah. Thank you for sharing that resource for the community. And thank you for your time today. I really appreciate your lending your expertise and lending your time today, because I know with your faculty job and research and teaching and all that, and just life in general, you have a lot going on. So I appreciate it. So take
Absolutely.
care,
I'm happy to
everybody.
be here.
And thank you, Crystal.
All right. Thanks.